Are you a breastfeeding mom who needs to take Tylenol? In this video, I'm going to provide an informative and evidence-based answer to the question of whether or not it is safe for breastfeeding moms to take Tylenol. 1. Is Tylenol considered safe to take while breastfeeding? The safety of Tylenol while breastfeeding has been a topic of debate. The American College of Obstetrics and Gynecology (ACOG) considers it to be compatible with breastfeeding and does not advise against its use in lactating mothers. However, some studies have suggested that large doses or long-term use of Tylenol may pose a risk to the baby. 2. Are there any potential risks associated with taking Tylenol while breastfeeding? Although Tylenol is generally considered safe for breastfeeding women, it may cause certain risks. Tylenol can be passed to the infant through breast milk, which can lead to overdose and long-term effects on the child's development. Additionally, there is some evidence that taking high doses of acetaminophen while breastfeeding will decrease a mother's milk supply. It is important for mothers to monitor their dosage and talk to their doctor if they are concerned about any potential side effects. Mothers should also avoid mixing Tylenol with alcohol, as this could increase the risk of adverse reactions. Lastly, mothers should always read all labels carefully and only take medicine in recommended dosages in order to reduce any potential risks associated with taking Tylenol while breastfeeding. With the proper precautions, most women can safely take Tylenol without any adverse effects for both themselves and their infants. 3. How much Tylenol can a breastfeeding mother safely take? The amount of Tylenol a breastfeeding mother can safely take depends on her health and the severity of her condition. Generally, it is recommended that an adult take no more than 3,000 milligrams per day in divided doses, with lower doses taken less frequently if needed. However, women who are breastfeeding should reduce this dose by half to 1 to 1.5 grams per day in order to minimize any potential risk to their baby. It's also important for nursing mothers to discuss this dosage with their healthcare provider before taking any medications. Additionally, pain relievers such as ibuprofen or aspirin may be safer alternatives for treating minor aches and pains while breastfeeding. 4. What are the side effects of taking Tylenol while breastfeeding? Tylenol is generally considered safe for mothers who are breastfeeding. However, it is important to remember that Tylenol can cause some side effects when taken while breastfeeding. These include nausea and vomiting, constipation, abdominal pain, loss of appetite, dizziness, drowsiness, and headache. In rare cases, it can also cause an allergic reaction or serious liver damage. If you experience any of these symptoms after taking Tylenol while breastfeeding, contact your doctor immediately. It is important to discuss any medications with your healthcare provider before taking them while nursing to ensure safety of both mother and baby. 5. Are there any alternative medications that can be taken instead of Tylenol? Yes, there are several alternatives that can be taken instead of Tylenol. Ibuprofen is an effective pain and fever reducer for breastfeeding mothers, as well as acetaminophen. Aspirin should not be used by breastfeeding mothers because it could cause irritation to baby's digestive system or even interfere with platelet function. Herbal remedies such as ginger, chamomile, and peppermint may also help reduce inflammation and/or discomfort in some cases. The best course of action is to speak to your healthcare provider before taking any kind of medication while breastfeeding. By doing so, you can get advice on the best alternative medications available and ensure your baby's safety at the same time. 6. Can taking Tylenol while breastfeeding cause any harm to the infant? According to the American Academy of Pediatrics, taking Tylenol while breastfeeding will not cause any harm to the infant. However, it is important for mothers to be aware that excessive or prolonged use of acetaminophen may lead to a decrease in milk production. Therefore, if this medication is taken while breastfeeding, moms should watch their infant's intake and output closely. It is also recommended that they limit their usage of acetaminophen as much as possible. If the mother notices any signs of decreased milk production or changes in her baby's behavior, she should speak with her doctor immediately. 7. What steps should a breastfeeding mother take before taking Tylenol? Before taking Tylenol while breastfeeding, a mother should always consult her healthcare provider. This is especially important if the mother has any underlying medical conditions, such as liver or kidney disease, as these can affect how well the body metabolizes medications. It's also important for mothers to be aware of potential side effects and drug interactions that may occur when taking Tylenol in combination with other medications. Before taking Tylenol, breastfeeding mothers should provide their healthcare provider with an updated list of all medications they are currently taking in order to reduce any risks. Additionally, it's important for nursing mothers to take only the recommended dosage for their particular situation and not exceed it without first consulting a healthcare professional. Avoiding alcohol, tobacco, and other drugs while breastfeeding is also recommended. Finally, if a mother is taking Tylenol for a fever or pain relief, she should monitor the baby's temperature to help ensure that her milk supply remains healthy and sufficient. In conclusion, taking Tylenol while breastfeeding is generally considered safe when done under the guidance of a healthcare professional. However, it's important for mothers to be aware of potential side effects and drug interactions that may occur when taking this medication in combination with other medications. We hope this video has been helpful in understanding how to safely take Tylenol while breastfeeding. If you have any questions or comments about your own experience with Tylenol while nursing, please leave them below. And don't forget to subscribe so you can stay up to date on all our latest videos. Thanks for watching.